Welcome back. A new CDC report is raising alarm as tick bite-related ER visits hit their highest level in nearly a decade. With tick season ramping up nationwide, health officials are warning Americans to stay vigilant. For more, let's bring in American Lyme Disease Foundation CEO Durland Fish. Durland, thanks so much for joining us this morning. I want to start here, with the CDC report. What is causing this surge? I mean, it's the highest in, what, a decade?
Yeah, well, the ticks that cause Lyme disease have been spreading their range throughout the Northeast and the upper Midwest, exposing more and more people to tick bites and Lyme disease every year. So it's not surprising that there are more this year. There's more Lyme disease cases every year, and it's been that way for the past 40 years.
Tick bites obviously cause some serious illnesses, including Lyme disease, Rocky Mountain spotted fever, but there's a lot of new concern about alpha-gal. Here's what HHS Secretary RFK Jr. said about it. Listen here.
Alpha-gal, which is another science fiction nightmare. You get one bite from a Lone Star tick and you could have a lifetime allergy to red meat. And I was surprised to learn on my trip to visit the Wampanoag for the Indian Health Services this fall that 50% of the population of Martha's Vineyard now has alpha-gal, including most members of the tribe.
I mean, that's a huge number. 50% of the population of Martha's Vineyard has a disease that makes you allergic to red meat. I mean, people hear that and they think, oh my gosh, how big a risk is alpha-gal?
Well, that figure is a little bit high. There's a test for alpha-gal antibodies. It's an allergy. It's not caused by an infectious agent. So if people might have antibodies to the alpha-gal, but they may not have symptoms, the red meat allergy symptoms. Only a small proportion actually do. But it's true that a lot of people are exposed to the bites of this Lone Star tick that is responsible for alpha-gal, and that these ticks are also spreading north and northward where they haven't been before. And so, again, more and more people are getting exposed to tick bites from the Lone Star tick.
Now, not everybody is aware when they get bitten by a tick. I'm in that population myself. I had Lyme disease when I was 12 or 13. I didn't get a bullseye rash and didn't know that I had it until I developed a secondary infection that caused my skin to turn white on my back and my neck, and they sent a biopsy. And it was a 7-year course of antibiotics that resulted in drug-induced lupus. Miserable. So what should people look for? What's their key to, hey, go to the hospital?
Well, again, the Lyme disease starts with a skin rash called erythema migrans. It's a red spot at the site of the tick bite. Most patients actually get it.
Thank you.
Be sure to like and subscribe for all the Fox News latest on YouTube and catch full shows streaming now on Fox One.